This is Simulation Center of Penza State University. It was organized in 2014 for training students of 3rd, 4th, 5th and 6th years of study. Let's go inside.
The Simulation Center takes special place in the structure of the Medical Institute of Penza. On the area of 330 square meters, there have been organized 2 lecture halls and 12 simulation classes equipped with dummies, mannequins, and simulators for various purposes. Medical science, as any other science, shifts towards robotization and the opportunity to train skills on simulators and dummies. It is an absolutely new way of training doctors. As of today, students from the 3rd to the 6th years of studying, interns and clinical residents undergo training in the center. It is also the place where future doctors pass the final attestation.
If green boxes are not appeared, the depth is not enough, it is less than 5 centimeters.
There are many directions of training, such as emergency aid, basic cardiopulmonary resuscitation, nursing skills, patient care, general medical and specialized skills, certain types of high-tech medical aid, and team cooperation.
This mannequin uses for immobilization of the broken extremities.
Here we attend our internal disease classes in this department. Here we studied on the objects and practical objects of monuments. Here we studied for any kind of wounds healing, about ECG analysis, all these kind of purposes or diseases, internal diseases which for human we studied here in this stimulation center.
In the traumatology and surgery classroom, you can see mannequins for basic surgical manipulations training. Mannequins imitate open pneumothorax, bone fractures, soft tissue traumas of head and neck, craniocerebral trauma and other injuries. Students perfect their skills in applying bandages, immobilizing limbs, applying tourniquets, central vein puncture and intubation of trachea.
In Penza, so practically is a good. Is a body is a really is a to practice on the body.
The anesthesiology and resuscitation classroom is equipped with simulators to train skills in basic cardiopulmonary resuscitation, mouth-to-mouth, mouth-to-nose, artificial ventilation using a laryngeal mask, the combi tube, and external cardiac massage. There is an opportunity to stimulate different heart rates and to perform defibrillation.
Okay, boys, your task here is to resuscitate a patient in clinical death. Death type will be ventricular fibrillation.
The center has an obstetric simulation classroom. NOL multifunctional delivery simulator is a mannequin of a woman in labor and a newborn. The system can simulate a normal delivery course and various complications, such as tachycardia, pressure drop, convulsions, cord prolapse, postpartum hemorrhage, fetal and newborn hypoxia.
Find second intercostal space.
Okay.
This one is first one, under the clavicular. This one is second one.
One of the most popular is the internal diseases simulation classroom, equipped with a patient simulator imitating human sounds. The mannequin helps train a wide range of skills, from heart, lungs and intestinal auscultation, pulse palpation on carotid and radial arteries, intravenous injections to pleural cavity drainage, intubation of trachea, defibrillation and external cardiac pacing. Program scenarios give an opportunity to train the tactics of team interaction in different clinical situations.
So, you saw our work. At our disposal is more than 30 mannequins which allow us for comprehensive training of all practical skills before the contact with real patient. And I think that practical skills accurate in our simulation center are very essential because they can save someone's life.